because my staff prepared a whole bunch of questions for me, which I'm going to submit almost all of those for you to answer in writing. But what really strikes me is how it seems to me we're trying to do public health on the fly here, because we don't have the data of how an oil spill like this, it's, we're resisting calling it a spill. It's such a catastrophe, will impact public health. And what strikes me is, in all of your written testimony and then your verbal testimony today, you're talking about putting together the worker monitoring, you're putting together the different lists and so on. But what I want to know is, do we have enough data to tell people about the potential health risks and to warn them about what they should or shouldn't be doing? I'm wondering if anybody can answer that question. Yes, Dr.
Well, I'll start. First of all, you're absolutely right. We don't have enough information. I wouldn't say we're doing public health on the fly. I've been in public health for many years. We know how to do monitoring, how to do surveillance, how to work with the health system.
That's just great. And I'm glad you're monitoring and you're surveying. But my question is, let me just, Dr. K, and I'm not meaning to be critical of you, but when we were down there last week, we were talking to folks who were concerned they didn't know what to do. We were talking to workers who were saying, we're being told by OSHA to wear breathing masks, and then we're being told by BP that the risk of heat exhaustion is such that we shouldn't wear the breathing masks, and they didn't know what to do. But then we received an email. We received actually a bunch of emails from Dr. Gina Solomon's blog, which talked about, she's of the National Resources Defense Council, and yeah, she testified, and about people who don't know what to do, not just the workers, although we're hearing concerns from the workers. This one gal said, I am pregnant and concerned about the health of my unborn baby. We live about a half a mile from the Mississippi Gulf Coast. I'm concerned about the fumes that my family is breathing. Do you have any more info on this or other areas to find info on it? You said miscarriage is possible for pregnant women. What stages would this be? All stages or up to a certain trimester? I also have 2 children under 5 that I'm concerned about the impact on their development. I am seriously considering leaving the area. Do we know what to tell people like this, and are we telling that to them?
Well, they don't have anything.
First of all, there's a great deal we don't know, and that's exactly why we're having the Institute of Medicine do the workshop next week. We're very concerned about vulnerable populations, and we've asked experts. The Institute of Medicine has brought in experts addressing these issues with children, with pregnant women. We know they're vulnerable to many exposures.
So, yeah.
We don't know in this case.
But here's the thing, and I think this is a great opportunity for us to get more data, but we're hoping on the other end that we'll put regulations in place and supervision so that we don't have oil spills like this. So we'll get the data for the next one. But my question is, so you're bringing the Institute of Medicine, you're bringing everybody in, that's great, but what are we going to tell this gal? What are we going to tell everybody else to do? Because it does no good to just collect the data if we don't have something to tell them. Like Mr. Taylor saying, we know what we're going to do with the fish. We're going to tell people not to fish there and not put those fish on the market. What are we going to tell these people who live along the Gulf Coast, or the people who are the fishermen, or the people who are helping remediate it? What are we going to tell them to do, and when?
At CDC, we have a website that has information about food, about smell, about swimming, about water, about drinking.
Yeah, okay, so if people smell the oil, what are we telling them to do from a public health perspective?
Well, odors, some people are very sensitive to odors, and obviously we'd like people to, avoid if they're in an area in which there's a lot of odors, and certainly in workers' populations, they could be in those areas
okay,
at work.
But like if people are smelling bad odors, that's because there's some substance in the air, probably oil, that smells. Do we have some knowledge or sense that
Well-
that might have some adverse effect and maybe tell them to stay indoors, or I don't
Exactly.
know.
That's exactly what I just said.
Okay.
About trying to avoid it. I think we should point out that the human olfactory nerve at the top of our nose is probably the most sensitive measure of hydrocarbons that we can have. A lot of the instruments that we use that find undetectable levels that we measure often are not as sensitive as our nose. So the nose is extremely important. If you smell hydrocarbon, try to get away from that area, go inside.
And have we told that to people?
The gentlewoman's time has expired.
I apologize.
That's all
I'm
right.
going to ask you all to supplement your answers because I think these are really important questions.
Any written questions you'd like to submit, sure.